You were one of the key early signatories to the Great Barrington Declaration, this call for there to be focused protection, as you say, for those who are most at risk, rather than locking down the entire healthy population of nations. Something actually which is in line with what the World Health Organization advice on pandemics has always been.
Yeah, I mean, I think the old pandemic plans called for focused protection. The Great Barrington Declaration, in that sense, is nothing new. It's actually a call for a return to old practices. I
Established
think that
practices, yes, the ones that worked, you mean?
yeah, I mean, for a century we followed them for every other pandemic, and for some reason we chose a different path this time.
Yeah, indeed. Well, again, if you look at it, certainly in the UK, hospitals and care homes accounted for 3 times more fatalities than all other settings put together, because that's where the vulnerable were. And again, very few of the cases that we actually saw ended up actually coming out from the community. Let's talk then about how we do get back to normal life as and when people do come out of lockdown here in the UK. And obviously, it's happening at different paces in the United States, in various different states. But vaccine passports is what has been suggested here by the government. They've ummed and ahed about it. They said different things on different days and different months. We know the American federal government, the White House, have said there won't be a federal vaccine passport. Various states like Florida and Texas have ruled them out and said they won't happen. New York have already got one going. I understand there are already some problems there. But do you think there is a case, though, for a way for people to prove that they have got antibodies, not got COVID at the time, have had a test, or have had a vaccine, for them to rejoin communal life in a pub, in a shop, at a football match?
I think the vaccine passports are a solution in search of a problem. If someone is nervous about being exposed to COVID, they can get a vaccine. No one is stopping them from doing that. You can resume normal life with the population levels of COVID you have now, because as long as the vulnerable are protected, what is the argument, right? The infection fatality rate from COVID for the non-vulnerable is incredibly low, right? The worldwide infection fatality rate, according to the World Health Organization, is 0.2%. It's really, I mean, 0.2%. It's 2 out of 1,000 death rate, and it's much lower in the non-vulnerable population. So I don't think the vaccine passports are a good idea. In fact, in many ways, they undermine public health. They're saying to the public, look, we're going to divide you into two castes. One caste is allowed to participate in society, the other caste is not. Public health should not seek to divide the population in that way. It's already divided enough over the lockdowns. It's created enough havoc. We don't need the vaccine passports in order to resume normal life. We can resume them just with the vaccines as they are, and good public health messaging about who really is at risk.
I mean, and this is the key thing, isn't it? And that was, say, something the Great Barrington Declaration focused on, was that there's no point locking down healthy people who are at incredibly low risk in order to protect people who are elderly and at higher risk, who should themselves be perhaps shielding and taking care of themselves. And there is an argument, is there not, that actually young people being out and about, young healthy people being out and about, actually helps protect the older, more vulnerable people, particularly those perhaps who are too frail, vulnerable, to be able to get the vaccine.
Yeah, I mean, I think that's the key point, and you raised it really well. You put it really well. When the young people are doing normal young people things, they are protected from the lockdowns, which have harmed them in palpable ways. At the same time, they are, in a sense, creating a bulwark, a firewall, so that the epidemic doesn't spread, because they are protected from the disease. And then now we have the vaccine to protect the elderly. I mean, some of the pushback that we got when we wrote the Great Barrington Declaration was that it would be impossible to protect the elderly. The only way to protect them is by lockdown. In fact, that's proved untrue. The lockdowns did not protect the elderly.
Yeah,
But
that's the very, very sad bit. Exactly, we lock down entire populations without getting that protection. What do you make of the claims that it is lockdown, though, that has led from the UK in January having the highest death rate at one point in the whole of Europe, to now the UK having the lowest death rate in the whole of Europe, below very successful Nordic countries like Norway and Denmark? We're told that is due to the vaccine rollout, but also due to lockdown, which we've been in since January the 4th. Is there evidence for making that statement?
unfortunately, no. Really, what you need is a control group. Like, what you have to answer, what would have happened had the UK not locked down. So for there, I think a very clean example is to look, for instance, at California, where I live, which is still locked down in many ways. My children still are not allowed 5 days in school. Church attendance is outdoors. There's still business restrictions. Versus Florida, Disneyland in California is closed. In Florida, on the other hand, it's actually been open since May. Disney World is open for business. You can go to Disney World in Florida. Schools are open 5 days a week in Florida. 100% of kids. And yet the death rate is the same from COVID, more or less exactly the same from COVID in California versus Florida. The number of cases overall is roughly exactly the same. The age-adjusted death rate is actually lower in Florida. They had fewer deaths. Florida is one of the oldest populations in the country, in the U.S. California is one of the youngest. You would have expected much higher death rates in Florida, and yet they're the same. The lockdowns did not protect California from these deaths. All they did is cause harm to our children, to our working class, to the poor, with absolutely no benefit regarding protection against.
This is the thing that I think a lot of people who are very pro-lockdown and find it very hard to believe, because lockdowns have become a sort of a way of sort of signaling you're a good person. But of course we should lock down. We should take this sacrifice because we are saving lives. You've been part of a number of international studies, not just looking at California and Florida, but international studies looking at huge numbers of countries around the world and comparing based on the demographics of those countries, particularly looking at age and how urban countries are as well, but looking at all the different lockdown policies brought in, whether they were brought in sooner, whether they were brought in stricter, whether they went on for longer, how many people they affected, etc. And you found no correlation whatsoever between.
Yeah, I mean, it's really hard to find an effect of these severe lockdown policies on case spread for this disease.
It's not just that there is an extra cost of lockdown on top of because your lockdown affects other people's lives. It's that lockdowns don't even save COVID lives, is what you found.
That is correct. And I think the key thing to think about. I mean, we think about lockdown as if we were all just. You can say separate apart from each other. And actually, if that were true, if it was actually the case that we could stay separated from each other for sufficiently long, COVID would stop spreading. That is true. However, society can't work like that. Someone has to grow the food. Someone has to go shopping. Someone has to there's essential work to be done. What lockdowns have done is transfer the risk to the essential working class, and said, look, you get exposed yourself. You take the burden of the disease spread, while we, the laptop class, sit comfortably in our houses, protected from COVID. It's an incredibly unequal policy. I call it a trickle-down epidemiology, because we aren't rats in cages that can stay spread apart. We have to intermingle eventually, and that's why lockdowns fail. They may push cases off into the future a little bit, but they cannot last. And they haven't lasted. And basically almost everywhere where lockdowns were imposed, as long as they weren't imposed in some remote island in the South Pacific, you're going to see they fail to actually contain the spread of the disease.